Did you know that every 3 seconds, someone in the world develops dementia? It seems like a distant statistic, but behind this number are real stories. A mother who begins to forget her children's names, a grandfather who gets lost on his way home, a mind that gradually fades away like a light losing its brightness. I'm Dr. Olivia Thompson, a specialist in preventive medicine and holistic health, and today I want to share information with you that could change the way you age. The most alarming thing is that some of these stories could have been prevented. Recent research points to something many people still don't know. 3 common groups of medications used daily and with complete trust may be accelerating brain aging and significantly increasing the risk of dementia. These are medications that might be in your medicine cabinet right now, prescribed for sleep, pain relief, or controlling simple symptoms, but whose hidden effect on the brain is becoming increasingly evident in current scientific studies. If you're over 60, care for an elderly person, or simply want to protect your mental clarity throughout life, pay close attention to what I'm about to explain, because understanding this could be the difference between aging with clarity or gradually losing what makes you who you are. Before continuing, I want to make it clear that this information isn't meant to create fear, but awareness. Don't stop any treatment without consulting your doctor. The goal is for you to understand the potential risks and be able to discuss safer alternatives with your healthcare provider when possible. The first group of medications I want to highlight are what I call the rest pills. These drugs promise calm, relaxation, and restorative sleep. I'm specifically talking about benzodiazepines and non-benzodiazepine hypnotics, commonly known as sleeping pills and anxiety medication. But this immediate relief may come at a very high price for your long-term brain health. These medications work by reducing brain activity, which directly interferes with the formation of new memories and cognitive processing. A study published in the British Medical Journal found that people who regularly used benzodiazepines had up to a 50% higher risk of developing dementia compared to those who didn't use them. Have you ever wondered if that medication you take for sleep could be affecting more than just your sleep cycle? At first, these drugs seem harmless, a small dose to turn off your mind and rest. However, over time, not only does physical dependence develop, but the brain begins to lose agility, concentration, and learning capacity. The result is a silent mental aging that accumulates night after night, pill after pill. What alternatives exist? Cognitive behavioral therapy has proven to be extremely effective for insomnia and anxiety problems without the cognitive side effects. There are also sleep hygiene techniques, such as maintaining regular schedules, avoiding screens before bedtime, and creating an environment conducive to rest. Melatonin in appropriate doses and under medical supervision may be a safer option for some people. And in cases where medication is absolutely necessary, there are alternatives with less cognitive impact that can be considered with your doctor. The second group of medications we should watch carefully are what I call brain silencers. These medications have something fundamental in common. They're anticholinergics, which means they block the action of acetylcholine, an essential neurotransmitter for memory and reasoning. They're present in medications for allergies, dizziness, urinary incontinence, and even in some antidepressants and Parkinson's medication. With the continuous use of these drugs, the brain literally loses internal communication. Neural connections become slower, learning decreases, attention scatters. Research conducted by the University of Washington found that people exposed to high levels of anticholinergic medications had up to a 70% higher risk of developing dementia. And here comes the most concerning part. This effect can persist even after stopping treatment. It's like a stain on the wall of the mind that won't come off. Do you know how many anticholinergic medications you're currently taking? Many people aren't aware that several of their regular medications belong to this category. Some common antihistamines for allergies, medications for vertigo, for overactive bladder, and even some antidepressants have anticholinergic properties. The cumulative effect of several of these medications can be especially harmful. The good news is that for almost all anticholinergic medications, there are alternatives with less cognitive impact. For example, there are new generation antihistamines that don't cross the blood-brain barrier so easily. For bladder problems, there are physical therapies and habits that can reduce the need for medication. The key is to review your complete list of medications with a geriatrician or doctor specialized in pharmacology who can identify possible safer substitutes. The third group of medications I want to mention are the powerful anti-inflammatories, specifically systemic corticosteroids. They are true lifesavers in times of crisis, used to treat severe inflammation, severe allergies, or autoimmune diseases. But their prolonged use has a direct impact on the brain. It reduces the volume of the hippocampus, the region responsible for memory and emotional balance. A study published in the journal Neurology demonstrated that people who regularly used oral corticosteroids showed a significant decrease in brain volume and an increased risk of cognitive deterioration. Additionally, these medications increase blood sugar, impair sleep quality, and alter mood, creating a dangerous cycle of stress, confusion, and forgetfulness that can accelerate neurodegenerative processes. These medications can save lives without a doubt, but used without a clear strategy and for prolonged periods, they can slowly erode the mind. Are you taking corticosteroids regularly for some chronic condition? If so, it's important that you work with your doctor to find the minimum effective dose or explore alternative therapies. For conditions that require long-term use, there are options such as inhaled or topical corticosteroids that have less systemic absorption and, therefore, fewer effects on the brain. There are also modern biological medications for certain autoimmune diseases that can be alternatives with less cognitive impact. Complementary therapies such as anti-inflammatory nutrition, adapted exercise, and stress management techniques can help reduce the need for these powerful drugs. Now, what can we do with all this information? It's not about living in fear. It's about living with awareness. I propose 5 practical steps to protect your brain while taking care of your health. First, review all your medications. Make a complete list, including those you take without a prescription or only occasionally. We are often not aware of the number of drugs we regularly consume. Second, schedule a specific appointment with your doctor to discuss the cognitive impact of your medications. Ask directly, can this medication affect my memory or brain function? Are there safer alternatives? Don't be afraid to start this conversation. Third, consider non-pharmacological alternatives. For many conditions, there are effective complementary treatments, physical therapies, nutritional changes, relaxation techniques, supervised natural supplements, and lifestyle modifications that can significantly reduce the need for medication. Fourth, if you need to take any of these risk medications, look for strategies to mitigate their impact. This may include cognitive stimulation therapies, regular physical exercise, neuroprotective nutrition rich in antioxidants and omega-3 fatty acids, and activities that promote cognitive reserve such as continuous learning and social interaction. Fifth, and finally, stay informed. Science is constantly advancing, and new research on medications and brain health is emerging. Follow reliable sources, don't hesitate to seek second opinions, and make the protection of your brain a health priority as important as caring for your heart or maintaining a healthy weight. Have you noticed that we rarely consider the impact of medications on our cognition? We tend to worry about side effects like nausea or fatigue, but we seldom ask, how will this affect my brain in the long term? It's time to change this mindset. Remember that healthy brain aging begins long before old age. The decisions you make today about your medical treatments can have a profound impact on your cognitive ability decades later. A longitudinal study from the University of California demonstrated that people exposed to these three groups of medications during middle age had a significantly higher risk of developing dementia in old age, even after adjusting for other risk factors. The key is not to accept forgetfulness as an inevitable destiny. Part of dementia may be inevitable due to genetic factors or the aging process itself, but another significant part can, and should, be prevented with informed decisions about the medications we consume. I'd like to briefly share the story of Helen, a 72-year-old patient who came to my consultation with complaints of progressive memory loss. After reviewing her history, we discovered she was simultaneously taking a first-generation antihistamine for her allergies, a medication for overactive bladder with strong anticholinergic properties, and occasionally sleeping pills. We worked together to find safer alternatives for each condition, and in just 3 months, her family noticed a significant improvement in her memory and mental clarity. Cases like this show me it's never too late to intervene and protect brain health. Of course, each person is unique, and what works for one may not be appropriate for another. The key lies in personalized medicine, in constant dialogue with healthcare professionals who understand the importance of preserving cognitive function while treating other conditions. Protecting your mind is protecting your history, your identity, your freedom, and your independence. And this is perhaps the most profound way of taking care of yourself and those you love. Imagine being able to age while keeping your memories intact, your personality vibrant, your ability to recognize your loved ones, and living with autonomy. This possibility is more in our hands than we believe. I invite you to share this video with those who could benefit from this information. Your parents, grandparents, family members who take regular medication, or anyone interested in maintaining their long-term brain health. Knowledge is power, and in this case, it can be the difference between aging with mental clarity or being marked by the fog of forgetfulness. If this topic has been useful to you, let me know in the comments. Tell me if you've experienced cognitive effects from any medication, or if you have specific questions about safer alternatives. And of course, don't forget to subscribe to the channel to receive more information about how to protect your health in an integral and conscious way. Remember that dementia is not always inevitable. With adequate information and conscious decisions, we can take significant steps to protect our brain while caring for our general health. I'm Dr. Olivia Thompson, committed to your integral well-being, today and always. See you in the next video.